Morning, everyone. Thank you for tuning in to our webinar to discuss Tell Your Story for World Contraception Day today.
And I am really excited to have Steph with me here today. So I'm Shannon Hill, I'm from Women's Health Grampians, I'm the Sexual Health Advisor, and Steph is, I guess, the newest member of our Sexual and Reproductive Health team, and I'm really excited to have her with me here today to tell you about this new story. So before we kind of kick off into the main event, we like to start by acknowledging the traditional owners of the lands that we're joining in from today. So we're here in Ballarat in Wadawurrung country, and we pay our respects to their elders past and present. And we acknowledge that Aboriginal and Torres Strait Islander peoples have the oldest continuous living culture in the world, and that sovereignty is never ceded. And this always was, and always will be Aboriginal land. To give you anyone who hasn't perhaps worked with Women's Health Grampians, to give you a quick overview of who we are. So Women's Health Grampians leads the health promotion of across the Grampians region. So that's all 11 local government areas. And we do that on 3 topics. So gender equality, preventing violence against women, and promoting sexual and reproductive health. So in the area of sexual and reproductive health, a main focus has been for us to increase women's access to timely local services. So that's been a focus for us for quite some years now, and thinking about the ways that we can increase reproductive choices for women living right across the region. So the region looks like this. We have, as I said, 11 local government areas. They kind of follow from the outskirts of Melbourne to sort of Bacchus Marsh in the closest part of Melbourne, right out to the South Australian border. So we've got towns like Eden, Hope, Caniva, Warwick, Nabil, Hopetoun at the back of the Wimmera, and then the major centres through the middle of Horsham, Ararat and Ballarat. So quite a diverse region. And a big one to get across, but we try and do that as best we can. So what did we want to talk to you about today? World Contraception Day, how exciting. So we will take any excuse to talk about sexual and reproductive health, but we thought this was a pretty good excuse to talk about the 26th of December being World Contraception Day. The mission is to improve awareness of all kinds of contraception and enable people's ability to make informed choices. So that's at the centre of everything that we do every day. And I was pretty excited to hear that it was World Pharmacist Day yesterday. So thank you to all the pharmacists out there that help us get the contraception access that we need. So we wanted to whip you through a couple of things. We've got some data that kind of gives us a bit of context or a picture of what contraception access looks like across the Grampians region. Then we'll get Steph to tell you what is this Tell Your Story project all about. And then we want to do a bit about where can you go to get help. So connection to services that are relevant in this area. So without boring you too much, I promise there's not too much data, but we want to just whip you through a bit of the data. For World Contraception Day, we've focused on IUD and implant-on access. And this is really just to give you a bit of a sense of when we go out to seek services, do we find what we need is I guess a question that we always have first and foremost in our minds. With the Grampians region, as you can see here, we've given you a picture of 2017 to 2021. So looking at a bit of a trend over time. The very clever people at Women's Health Victoria have given us this data in the Women's Health Atlas. So this is publicly available data that you can access should you need to. And yellow, if we're looking at 2017, I guess on the left, if we're looking at yellow is very low or no service provision. So you can see in 2017, we have quite a lot of yellow places like West Wimmera, Hindmarsh, Yarriambiack, Northern Grampians. And you can see the centres there in the middle. So Horsham, Ararat and Ballarat in 2017 seem to be providing the central service for IUDs. When we move forward to 2021, we're looking at what has changed. So Horsham seems to have maintained a very similar rate of services when we move forward, but Ararat perhaps has had reduced services in comparison to that 2017 data. So it doesn't always follow the trend that over time services will build or maintain. So we're really interested in watching that data trend over time and what that means for access for women. So this is a really interesting way of looking at the data, and this has been super helpful in my work. Here we can see on the left the patient location, so the number of services received by patients across the region. And then on the right-hand side is the number of services by prescriber location. And you can notice here the trend is that there are more patients. So this blue-green in the left-hand side is really telling us that more patients are looking for IUD services than are provided. So on the left, when we compare it to the yellow, the low service provision, the no service provision. So interestingly here too, we can get from the Women's Health Atlas a regional rate of provision. So Grampians have a rate of patients seeking services at 7, which is slightly higher than in Victoria, a Victorian average. But on the prescriber side, the regional rate of provision is lower than Victoria. And that's interesting to me that we're seeking services at a similar rate to anyone across the state, but we've got a lower rate of provision. So there's an opportunity there, hopefully, to try and match the service, what patients are seeking with the services that are delivered on the ground. And when we move forward to Implanon or contraceptive implants, we can see a very similar story. So here again, the trend over time, in 2017, we still had quite a bit of yellow, so no service provision there in Yarriambiack, Northern Grampians and Pyrenees Shire, but some service provision or higher service provision in Horsham, Ararat and Ballarat. Now, when we move forward to 2021, we can see that those main services through Horsham, Ararat and Ballarat have sustained or remained there, and there must be some service provision. So even though it's low, there's some service provision picking up in those other local government areas. So it's good to see that there is a change over time with Implanon. But when we compare, again, the patient rate, so the patient rate on the left-hand side, compared to the prescriber rate, we can still see some significant differences. So I've just picked out 3 there for you to give you an example of that. In the middle, Pyrenees Shire has the highest rate of people seeking Implanon in our local government area. So we can see there a rate of 10.62. When we're looking over at the prescriber side, it's compared to 5.99. So you can kind of see that mismatch is almost kind of a double the amount of patients seeking services to what's provided locally. So that for us is an interesting thing to watch. Previously, if I looked at the data and just saw that services were being provided, I thought, great, job done, services are provided. But this comparison, the 2 side by side, is really telling us something quite different, that perhaps what we're seeking locally might not be available. So you've got the comparison rate there. Yarriambiack and Golden Plains are in a similar situation across the state. So that's just to give you a quick sense of perhaps in the Grampians region, we don't have as much service provision as we would like to see, and there could be opportunities to increase that service provision. So what happens next? Really, once we got a look at this data, we thought there's more here that we need to know. What is actually happening when women go to seek services? So the numbers are amazing and they give us a certain amount of the picture, but we don't know what happens when women go to seek services. Do they find what they need? Is it easy to find? Is it local? Is it costly, or is it available via bulk billing? Do they prefer to travel for privacy? So this is when we decided to bring Steph into the picture and launch this new project, which is called Tell Your Story. So we wanted to capture more about women's experiences here to really round out this data set and get a better understanding of what the priorities for women are. So Steph, what have we got in terms of the Tell Your Story? Tell us what's happening, how are you doing it, why are you doing it, and what comes next?
Thanks, Shannon. So I think Shannon's given a really good summary as to why we're doing Tell Your Story. But basically it's that we've got these numbers on a page, we've got the maps with the color coding, and all of that data is really fantastic. We've got past research that's been done by Women's Health Grampians, which was looking at GPs and access to increasing reproductive choices to see sort of what was going on from the healthcare provider perspective. And what we felt was missing was the stories and the lived experiences of the women and the people who are accessing these services in the Grampians region. So what we're hoping is that by hearing these stories and giving people the opportunity to tell their story, is that we can get a greater understanding of the complexities of accessing sexual and reproductive health care in a regional area, more so than we can with just the data alone. So how we're doing this is a bit of a combined approach. So there is an online survey that people can take. It's all anonymous and all the data from it is de-identified to protect people's privacy. People can also do an interview where they sit down with usually myself, but it might be Shannon, and just talk more in depth about their experience if they're willing to share. And there is also going to be some focus groups where people can join in and tell their story in a group setting if they find that to be more comfortable. And the outcome that we're aiming for from this project is to just really get a better insight into what the priorities are for women in the Grampians. What are their values? What are the things that they would like to see in their local area, so that we can continue to advocate for them and to work with providers to see if we can fill in these gaps that we know exist. Because we know that there is a whole bunch of wonderful healthcare providers and services and organisations out in the Grampians, but we also know from the data that something isn't quite meeting the mark yet, and that's sort of where we come in to see where can we fill in these gaps. Is it that people need more training or education? Can we link them in with that? Whatever it might be, that's what the data that we're getting from Tell Your Story is going to be really useful to just make sure we're not missing anything and that we're not making assumptions about what people want. We're actually getting it from them, and that they have the chance to inform the direction of women's healthcare in their region. So some of the things that we're surveying in Tell Your Story are demographics of the people. We want to know what their priorities are when they're accessing sexual and reproductive health care, what their values are. We want to know their opinions on what is currently being provided. We're not looking for horror stories. We are really hoping to hear those good stories as well about what is working well, and that hopefully we can then take things that are working well and replicate them in areas where there are these gaps. We want to hear people's stories and understand the complexity of them. It's actually why I chose this little graphic up here on the screen. It was just to sort of visually demonstrate how women's lives are not single issue things. We all have different complexities that influence how we access healthcare, and we want to know which ones in particular are most prevalent among women in the Grampians so that we can advocate for their needs. And we really want to hear ideas from women themselves about what they think would be useful in their communities, because we know that women are experts on their own bodies and that women are much more likely to be able to tell us what's going on the ground in their community, especially in smaller towns, and what would work well to provide services in those areas. So you can see here, this is just one of the questions that is in the survey. If you were to take it, you can see people can choose multiple options of things that are important to them when they're seeking healthcare. And this data that's coming through is really interesting and really helps us to direct our attention to the areas that people find most valuable to them. This slide here, you can see, this is an example of where we're wanting to get people's opinions on different aspects of sexual and reproductive healthcare. So this question is asking how confident someone feels about being able to access a long-acting contraception option if they wanted one. And then this is a more open-ended style of question here, which is asking people for their ideas about what is provided in their area and what they think could be or should be provided in their area. And then we aren't really releasing any of the data from Tell Your Story yet because it's still in its infancy, and we want to make sure we've got a really well-rounded cross-section of women's stories from all over our region before we go releasing any data. But one statistic that we are going to share today is got to do with 1-800-MY-OPTIONS. So 1-800-MY-OPTIONS is a service that is run by Women's Health Victoria and supported by Victorian Government. It was started in 2018 as part of the Women's Sexual and Reproductive Health Key Priorities, and it's aimed at reducing barriers for women who are accessing reproductive and sexual healthcare services. So what it is it's a confidential and free phone line and online service that can provide information about contraception, pregnancy options, abortion, and sexual health. It's pro-choice, non-judgmental, woman-centred and independent, and it works along hundreds of healthcare providers all across Victoria. And some of the data that's come out of Tell Your Story so far is that about 70% of our respondents have not heard of 1-800-MY-OPTIONS, which really made us think that this is such a great opportunity to use 1-800-MY-OPTIONS resources to help fill in some of those gaps and to increase the public knowledge about what services are out there and how to best find them and access them. So 1-800-MY-OPTIONS isn't just for members of the public and the community to access. It's also a really great resource for professionals. And the team at 1-800-MY-OPTIONS are more than happy to take phone calls or inquiries from healthcare providers about if you're wanting advice on where to refer a patient or where that you could seek some training or education for yourself. They are just gurus. They seem to know all the ins and outs of sexual and reproductive healthcare in Victoria and are really more than happy to help people access what it is that they need, both if they're on the patient side of things or the provider side of things. And then this next slide, you can actually see this is their training and support page on their website. And you can see here that they actually have so many options, links to services and training courses that you can do. And a lot of these are free to access and available online, which is really important for us when we're looking at opportunities for people in the Grampians, because we know that having an online option is really important, given that people can't always travel to a bigger city space to attend education in person. So I really encourage you to have a look at this website and click on some of these links and see what training opportunities are available to you to look at. On this next, hold on, yep, there we go. So what we wanted to share with you is how you can help to make this Tell Your Story project successful and how you can take part And I've got a few things here just to show you what you could do. So one thing is that you could take the survey yourself if you're living in the Grampians region, or you've accessed healthcare in the Grampians region. You could complete the survey. Again, it would all be anonymous and de-identified. And you don't have to exclude yourself if you're a healthcare provider, because all stories are valid and valuable. So you're more than welcome to complete the survey yourself. And you can also tell your friends, your family, your colleagues, your networks about Tell Your Story. We've got posters that we can send out. We've got digital files and social media tiles that you can share to increase our reach. Because it's really important to us that we get a really wide cross-section of stories. We don't want just stories from people living in the Ballarat CBD. We really want to make sure we're covering all of our local government areas and women from all different backgrounds, different experiences, so we can make sure we're getting a really well-rounded picture of what is needed in our region. If you are a healthcare provider and you provide sexual and reproductive healthcare services, we really encourage you to register your services with 1-800-MY-OPTIONS and encourage your colleagues to do the same. Like, if you know that someone in your clinic offers early medical abortion and they're not on our map, then please let us know. That you also have the option with 1-800-MY-OPTIONS to not have your data on the public web page, but that people could call up and be referred to you by the 1-800-MY-OPTIONS team if you didn't want to have your data available on the website there. And just encourage you to really use 1-800-MY-OPTIONS as a central source of information, not just for your patients, but also for if you're needing to make referrals or wanting to do further education. And then we are zooming through this, which is good because it leaves us lots of time for questions and discussion at the end. But these are sort of the key messages that I'm hoping people will take away from this webinar, which is promoting and participating in Tell Your Story will help us get a really well-rounded, holistic understanding of what is important to women in the Grampians when it comes to accessing sexual and reproductive health care. To make sure that you know all about 1-800-MY-OPTIONS and how valuable a resource it is, and encourage you to make the most of it. And also, just I suppose a little spruik for us here at Women's Health Grampians, that we work with regional partners all over the Grampians to build local capacity and promote training opportunities. So if you've got an idea and you'll be thinking, oh, it'd be really great if we could do this, but you just don't have the time or the energy or room on your plate to get that sort of thing up off the ground, get in contact with us, because that is the type of thing that we can look into and perhaps work together and get these things off the ground. And I think that was it for the slideshow bit, but we would love to know any questions that people have. I can see we've got a couple coming through already. But if you have any other questions, please pop them into the Q&A section.
Steph, I'm so excited about this project. I think for me, I've spent a lot of time looking at the data and working with service providers on this, and often we don't have time to go and talk to women. So if I'm a woman in the region and I haven't had maybe long-acting contraception that we've been talking about today, can I still do the survey?
Yeah, absolutely. So you don't have to have accessed long-acting contraception or an abortion to take part in the survey. We're really wanting to understand all women's experiences about accessing any type of sexual and reproductive health care. Because we know that women at different stages in their lives will have different contraceptive needs, and those stories are just as valid. So we're really wanting to know anyone from the age of 18 until no upper limit, really. We want to know anyone's stories, anyone who's willing to share anything, even if it was something that happened 20 years ago. It is still relevant because it helps us to then understand how things have changed over time, and trends that are happening. We really want to understand things about like local values, privacy. Do people feel well supported in their community when it comes to accessing sexual and reproductive health care? Do people feel like they can talk to their local providers? Are they getting information from their friends or their family? Are they going online? We want to know all the ins and outs really of people's sexual and reproductive health care, as long as they're willing to share, obviously, and anything that they say in our interviews it's all de-identified, and we're not going to blast you on Facebook with all your details. It would really just be looking for themes and trends of what's going on.
And how long would the survey take me to fill out?
It's about 10 minutes, I reckon. I don't think that there's a word limit on the question part. So if you wanted to write me an essay, you probably could, and that might take you a bit longer. But I think that the average response time is about 10 minutes. So yeah, very quick to do, and really, really valuable information for us when it comes to looking forward and just already seeing some really exciting data coming through that's helping us to know where we should be focusing our energies. And I'm really excited to be sharing that in a few months' time, once we've got a more well-rounded cross-section of women.
And I think the reach too, I was really pleased to see, we have such a big region, but we are getting responses from all different corners of the region. So if you feel like you know someone, or you've talked to someone that has a story, we'd love to hear it. It can be quite different. It can be different in Horsham or Warwick Nabil to what it's like in Ballarat. So really getting a sense of that is super important. And I get to work alongside some of the most amazing sexual and reproductive health providers. And I'm really hoping that we get to tap into those stories where perhaps seeing one of our local services has made a difference to you. So, has it reduced, the cost for your service because you didn't need to travel, or you didn't need childcare, or you didn't need to take time off work to get to a service. So things that are important to you will be super valuable for us to understand and go forward in our work.
We've got someone asking if we fit diaphragms as part of our portfolio. We don't here. We don't run a clinical service here. But we could find you someone who could. If that was something, we could definitely point you in the right direction for accessing those sorts of things. So we know that diaphragms are not an area that is really promoted a lot, and that there are some people that don't have a good understanding of how diaphragms work. But if this person wanted to flick me an email, I could definitely send you some resources of where the best place to find information on that would be.
Diaphragms are super interesting. In theory, they should be available at a chemist, but that's not always the case. So sometimes they need to order them in for you, and you might want to have a chat to someone about whether that's the right option for you. So something like a sexual health service that's run here in Ballarat as the Sexual Health Hub would be a super place to talk about that. But yeah, you might not be in Ballarat. So always happy to talk if you feel like you want to ask us a question, or the 1-800 My Options team, I bet, could do the same.
Yeah, for sure. Yeah. So someone is asking, what about abortion? And in the Tell Your Story, we are collecting stories on people accessing abortion as well. That is a really big part of our work here, is about making sure that women have access to abortion and helping that process to run smoothly. So those stories are really valuable and valid to us, and we would like to hear from people who've had abortions living in the Grampians region, or who have thought about having an abortion, because we know that different decisions for different people at different stages of their lives. So yeah, those stories are absolutely really valid, and we would encourage anyone who has a story about accessing abortion that they could talk to us if they felt comfortable, and that all of that would be handled really privately and really sensitively. We don't want anyone to feel uncomfortable. The interviews, feel like interview is not a great word for it, because it's not like a job interview with me firing questions at you. It's really a chance for you to tell your story. And we like to keep it fairly relaxed and unstructured, that people can just share what it is that is important to them, you know, what they remember from it, how they felt at the time, what was helpful and what wasn't, so that we can then use that information to help make improvements where we can, and to help support the healthcare workers that we know are doing such fantastic work across our region, to keep doing what they're doing.
So I guess the things that we can leave you with is that we are really happy to be in touch. So if you see an opportunity in our region for us to share more about the project or connect with services on the ground, we're really happy to talk about any opportunities. We can leave you with our email addresses and website there. You can find Tell Your Story on the front page of our website. And we will keep a recording of this webinar. So if you feel like there's someone who needed to hear anything that we shared today, we can send that out to you as well. But thank you, Steph, for sharing that with us. I'm really excited about this project. I can't wait to see the results at the end and what we can do to round out not only the data, what the data tells us about service access, but what women need and want. So thank you.
No worries. Thanks, Shannon. Thank you again, everyone, for joining us. It's been wonderful to see so many people tune in. And please don't be a stranger. Feel free to send us an email or to check out our website. We'd love to work with you in the future. And thanks.